Dr. Becky Fox, and today I'm going to show you how to adjust your HERBST AT Advanced Titration Appliance. This is the HERBST AT appliance, which stands for Advanced Titration. And in this appliance, the advancement is going to be at the back of the extension arm. But the HERBST AT, it's a great appliance. It moves side to side. You can open and close. The only direction that you can't fall is that lower jaw can't fall back further than where we have those bars set. And again, all the appliances are advanceable to find your optimal position to treat your apnea. So a few features to point out on this appliance. On the top of the bars, you'll see an arrow, and that is the direction you're going to want to be moving the wrench in. And you'll see a plus sign, so you know if you're advancing, you're adding an extension there, and it's in the direction of the arrow. And on the other arm, you will see the similar markings, and that is to again guide you in which direction you are turning the wrench. So both arms on the HERBST AT appliance both turn in the same direction. So you're going to be turning that wrench counterclockwise from the back position of the arm to advance it and extend it out. The bar itself will extend out, and you'll start to see the spacing develop on the front end or the anterior end of the arm once you start advancing it, but we will see that in a little bit here. So you just want to be sure you're turning in the direction of the arm to get that to advance further, which will eventually then ultimately push the lower jaw further forward until we get your optimal position. So the wrench itself is going to enter in the opening at the back of the extension arm, and that's the space where you will place the wrench. And this is a hex-shaped wrench, and I put a Sharpie marker on one end of it to orient myself, whether it's a 180-degree turn or you're turning a full 360-degree turn. It's just a little easier if you mark one of the ends so you don't lose your place when you're advancing following your titration schedule that we have provided for you. So with the HERBST AT, you're going to place the hex inside all the way to the bottom until you meet resistance. And you may have to kind of wiggle the wrench a little bit until you feel that hex engage the internal hex until it grips. You shouldn't feel like you're going to break the wrench, but you may meet a little resistance. And there you turn 180. And then if you go again, you've done a full 360-degree turn, which one 360-degree turn equals 0.25 millimeters. So to go a full millimeter, you would have to do 4 360-degree rotations on each side. It's always important to do each side equally so the appliance is balanced. And now that we've advanced it, you can start to see this little slot beginning to open up right there. The spacing is getting greater there. So the further you advance it, it pushes the mandible out, and you'll see that spacing open up. But always follow the schedule we've provided to minimize side effects, and the advanced titration HERBST is pretty easy to adjust. I hope this was helpful.